My name is DeMoss, and I'm a women's health nurse practitioner with Tennessee Oncology. I've worked with Dr. Steve Dudley, who's a gynecologic oncologist, for it was 30 years this past May, and I do most all of the sex education for Tennessee Oncology right now. So today what I want to do is kind of some myth busters. I'm going to we're going to go over 5 or 6 questions. I'm going to answer them in simple terms. So the first one we have is sex okay during chemotherapy? And this pertains to men and women. It's not just my female patients. So as a kind of a rule of thumb, we think about that chemotherapy is excreted through body fluids, and it takes about 72 hours for that to process through the human body. So whether you're male or female, you need to wait 72 hours before you're sexually active with your partner. Even with a condom, that doesn't matter because we don't want open mouth kissing either. The other issue here is there's a nadir period with most all chemotherapies, which generally happens at about day 14. And what that means is when your infection fighting cells are at their lowest, your white blood cells drop down. And that's when it's a little dangerous for the patient to be infected, get a bacterial infection or a viral infection. So we ask that you either use condoms or abstain for that 2 or 3 day period during your nadir as well. The other thing a lot of folks don't think about is because chemotherapy is excreted through body fluids, you need to make sure that you double flush when you use the bathroom and shut the lid before you flush. If you have children in the home, it's really nice if you have an auxiliary bathroom that you can use or a second toilet that the patient can use that's separated from the rest of the family. So the second question is going to be, is it okay to have sexual activity during radiation? And the answer to that is yes, as long as it doesn't hurt. Depending on where the radiation is, if it's external beam radiation, then there's no problem at all with being sexually active. If you do have an implant, then there is an issue there. So you've got to wait, again, the magic 72 hours after that implant is removed before you're sexually active. A lot of times if you have pelvic radiation, especially with women, there's a lot of burning. There can be vaginal discharge, even if this radiation is for colon cancer. So you need to make sure that you're using an ointment or a cream to help with the burns. And also if you choose to be sexually active, if you're really wanting to do that, even through the pain, you can ask your provider for a lidocaine or a numbing agent that can help. If you do use a numbing agent and the patient is the female partner and she's burning, your male partner is going to want to use a condom because otherwise it's going to make him last longer because he's going to be numb as well. Another thing that can come up is if you're on low dose chemotherapy, daily chemotherapy with radiation, should you be sexually active? And the answer to that is you need to make sure you watch your counts, and if your white count becomes at a dangerous level, then you need to not be sexually active even with condoms. The risk is too high for infection, whether it's with a bacterial infection or a viral infection, and folks can end up in the hospital. The next question is cancer contagious? The short answer to that is no. You can't take a cancer cell from one person and be intimate with another person and then take that cell on and it grow as a new cancer in their body. The long answer to that is human papillomavirus, or HPV, is the cause of many of our cancers: head and neck cancer, penile cancer, vaginal vulvar cancer, cervix cancer, anal cancer. It's all related to the human papillomavirus. So that being said, 80% of the population has been exposed to HPV. So you can kind of protect yourself from issues that surround that and it turning into a cancer or a precancer. And doing so, it's good exercise, good diet, decreased stress level. Those 3 things are good management skills to keeping the human papillomavirus from kind of taking over the body. The other thing is it really, really has an affinity for nicotine. So if you or your partner are smokers, try to make sure your hands are washed prior to sexual activity because you don't want that nicotine on the cervix or in the vagina from fingertips because HPV really does like that. Short answer is nope, it's not contagious. Long answer is try to protect yourself from HPV if you can. Again, like I said, 80% of people have been exposed. If you've ever been in a relationship with someone who's ever been with someone else, you've been exposed. Whether or not your body's immune system keeps it in check is what we were talking about, the exercise, decreased stress, and eating right. Next question is being sexually active healthy during treatment? And again, the answer to that is yes, it is good for you. If you had a healthy sexual relationship prior to the diagnosis and treatment, what's called pelvic congestion, or when there's that increased blood flow to the pelvis, whether it's for your male partner or the female partner, just the engorgement of the penis and or the clitoris and the vulva it's bringing real healthy red blood cells that are fully oxygenated to that area to help with healing. And then after orgasm, it releases that oxygenated blood back into the system. So yes, if you had a good sexual relationship prior to treatment, it's really good to continue it if you're interested in it. Not everybody is. So just listen to your own body and kind of how you feel about it. And if you're not interested, if you're too tired, that's okay too. Another issue that I come up with that happens quite a bit in my practice is vaginal dryness with women. Whether it's with chemotherapy, whether it's that they've had a hysterectomy and all of a sudden they don't have their hormones anymore, whether it's for breast cancer or uterine cancer or ovarian cancer, removing those hormones causes a lot of vaginal dryness. We call that surgical menopause. So there's a few options you can use. The first thing that I try to tell my patients to use is a coconut oil suppository. You can just scoop up 1/3 of a teaspoon of coconut oil, put it in the refrigerator so it's cool, because it's a solid oil, but it will melt with body heat. So prior to intercourse, insert the coconut oil into the vagina, wait 2, 3, 4 minutes, and then it will have melted enough. You can also coat the penis with coconut oil, and that will help as well. Another product that's on the market is hyaluronic acid, and the vagina is normally an acidic environment. That's just how God made us. I always say that the vagina is God's best self-cleaning oven, because bugs really like a dark, warm, moist environment, and that's the vagina. So if it's acidic, it can kill things. So hyaluronic acid is a normal base that's in the human body. It's in young females. When we're younger, it's a higher level in the vagina. As we age, that decreases whether or not we have cancer or not. So you can supplement that with hyaluronic acid suppositories that you can order either online, Amazon. I think they actually even make hyaluronic acid with vitamin E as well in it now. And those are all just over the counter. They're called nutraceuticals, so you don't have to have a prescription for it. Another option that some of my women are doing is called the Mona Lisa procedure, and the urologist will do that. And it's basically burning the lining of the vagina 3, sometimes 4 times over a period of time to rejuvenate and bring it back to its more youthful self. I would say there's probably about a 70% success rate with the Mona Lisa procedure. The downfall is insurance will not pay for it, and it's completely out of pocket, and it can be a bit expensive. Often urologists will say you're going to need a once a year boost, so to speak. So after you've done it the first, second, and third time, usually you're going to have a boost once a year. The last and final question I can think about that is pretty common is it normal to have decreased desire during diagnosis and or treatment? And the answer to that is yes, most certainly yes. The human body has what's called a fight or flight syndrome. And if you're walking the Appalachian Trail and you run into a bear, you have the desire to either run or fight, and it's called the fight or flight syndrome. So once we're diagnosed with cancer or we're in the middle of a treatment phase, we're fighting this disease. And running off and hiding in a cave with your partner and having sex when there's a bear right outside the cave is not something that a lot of people are interested in. So it's pretty normal to have a very decreased desire. A lot of folks are tired. They're anemic from their treatment. They may have burns from the radiation. There's all sorts of reasons that you could be not interested in being sexually active. What I do tell all my patients is if you had a active sexual relationship with your partner prior to treatment and you were comfortable with the way things were in that relationship as far as the sex piece of it goes, About 90% of my patients get it back, and often it's before treatment stops. So don't give up on it. Don't think it's over, because it's generally not over. If you're having a little bit of problems emotionally over body image issues, or you've got a colostomy now and you're just not wanting you're thinking you're not sexually attractive anymore, if you had your breast removed or you've had your ovaries removed and you just don't have the hormones you used to have, then you can see a counselor. There are general counselors. It doesn't have to be a sex therapist. You can see a general counselor for those issues. There's also the option to have, some women need what's called physical therapy, pelvic floor physical therapy. It's not unusual for women for intercourse to be painful, especially after radiation, and she'll need to be fitted for a dilator if she's not being sexually active. I do that through my office, but most of your oncology providers your oncologists will know who to send you to. But speak up. If you've had pelvic radiation, make sure that you mention that you're not being sexually active or sex with your partner is hurting and you may need to be fit for a dilator.